Welcome to Helping Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show is designed to help women become champions of their own health care. Today we're doing something kind of special. We're at the Greenway in Middle Tennessee, where we're going to be at the Run Chicken Run race in Murfreesboro, Tennessee. I'm joined by Andrea Hutton, Senior Exercise Physiologist from Middle Tennessee Medical Center's Wellness Center. Andrea, thank you for joining us.
Thank you for having me. Over the past 6 weeks, it's been my privilege to train Dr. Williams for this 10K race. A 10K is 6.2 miles. Therefore, during our training, we've run anywhere from 2 to 5 miles throughout the time. He's going to do great. He's well trained, so I'm excited to see what happens today.
We're going to go back to the studio, where we're going to be joined by Andrea and her colleagues from the Middle Tennessee Medical Center's Wellness Center. We're going to discuss wellness, rehab, and some of the offerings of the center. Please join us.
From the News Channel 5 Network, this is Health and Today's Woman with your host, Dr. Kelly Williams. Sponsored by Murfreesboro Medical Clinic.
Welcome back to the studio. Today we are joined by two of the staff from the Middle Tennessee Medical Center's Wellness Facility, Miss Andrea Hutton and Miss Ann Garner Sanders. This is a big topic in the news right now, this whole idea of wellness and healthcare. And I thought, what a better time to look at ways that we can produce and enhance our own wellness than to show it on my show. Well, today we're going to look at the wellness with them, as well as what we did recently when I ran the Run Chicken Run race in Murfreesboro, Tennessee. We're going to take a look now at some of the highlights from that race and begin to evaluate this. You can see we've got some people running here. It was a great race, and it was really fun to do. And here in a minute, I'm going to pass by. As you can see, I actually did survive, and it was a really good time. Now we're going to show you a little bit. We're going to go back to the race and cover a little bit more of the race after it was completed. We just finished the race, and what was the time, Andrea?
1 hour, 7 minutes, and 56 seconds.
Well, I'll tell you what, there's no better way to finish a race than to be at this finish line, have your daughters cheering for you. But this show is about wellness, and it's important that we're passing wellness on to the next generation in my daughters. Andrea, why don't you tell us a little bit about wellness?
Sure. Wellness is beneficial for women of all ages. This can be obtained through a lifestyle of healthy eating as well as consistent exercise.
We're going to return to the studio. We're going to continue to talk about wellness and its importance in healthcare. Come on with us. Well, now we're back in the studio, and I have to tell you, that was a really fun race and a great opportunity to do something that really does involve wellness. Now I'll be joined again by Andrea and her colleague Ann, and we're going to talk a little bit more about wellness and its importance in our life. Now, one of the things, Andrea, I want to mention, because you mentioned in your last segment, was this whole idea that wellness is not just about physical, but there are other aspects of wellness. Why don't you expand a little bit on that?
Sure. You've got aspects such as, physical, like you just said, mental and spiritual. The mental component would be just having a positive attitude, reducing stress, as well as just being positive. The spiritual component would be more like a meditation, prayer, finding a sense of self, as well as a stronger sense of purpose for your life.
One of the things that I think is really important is this whole idea of the next generation. As we were in that show and talking a little bit about my daughters, okay, and the fact that we're passing it on to the next generation, this isn't something that just affects the young or the old, but it's really all generations, isn't it?
Sure, very much so. It'd be great to start when you're young and then continue the healthy lifestyle throughout your years as you age. However, some people aren't able to start until they're middle age or they're later in life. It's still beneficial no matter what time you start.
And I think that's important, because one of the things I want to mention is a lot of people wonder about this whole idea of, do I have to join a fitness club, or do I have to do something, do something in order to be working on my wellness? That's not true. You can do lots of things at home, can't you?
Sure. If you wanted to start with the physical component, just a simple walk around your block a couple times a day, whatever's comfortable for you to get that heart rate going and to expand your physical fitness. You could also have more of a mental aspect, like I said earlier, with just maintaining a positive attitude and stimulating your mind, doing crossword puzzles, continuing to read, continue to educate yourself on health and wellness or topics of your choice. There is also part of a physical component that is more actual physical, such as maintaining a healthy weight. How about regular checkups, practicing good hygiene, making sure you're getting enough rest. All those things are very, very important, but they're easy to do at home.
And one of the things I think it's really important, as you mentioned, is this whole idea of getting regular checkups. And a lot of people don't realize, but wellness really does involve complete things, not just medical, not just physical, but it is important to get regular checkups, including dental checkups. Because a lot of people now are starting to see there's a big connection between wellness, health, and dental also.
That's very true. As we'll get into the cardiac rehab segment in a little while, but we are seeing now, whereas people who aren't taking care of their mouths as needed are ending up with different bacterias that will come and attack the heart. So the dental checkups are very important to make sure you don't have gum disease, you're not having other types of diseases and bacteria floating around your blood. That's
interesting because it's not something I think a lot of people think about, but it is important. We're starting to see dental care as a lot more important in a lot of areas, including what I do in OB. It's becoming more important. Now, we mentioned some things at home. What about some of the physical things that you could do at home? What do you suggest to people as far as wellness? Some real practical things that they can do at home that don't require necessarily joining a fitness facility.
Sure. As stated earlier, simple walks around the block and just moving more, going outside, playing with your children, walking your dog. Even in public, if you park in a further parking place and walk in, you'll get some exercise that way. If you ride a scooter because you are overweight or you've got some leg problems, how about ride the scooter to the aisle and then walk down the aisle, pick up the item you need, and sit back down. You could also do simple strength training exercises at home, just using body weight, such as squats or push-ups against a wall. Stretching is a very important component of exercise and of wellness. That's the most forgotten point. Flexibility is very important to maintain flexible muscles and flexible joints. It will lead to less injury.
Well, that's great. I think we've had a great discussion about wellness, but some of the things that are really special about the Wellness Center at MTMC is it's not just another fitness center, but it really involves a medical component. In our next two segments, we're going to look at people who have a disease and try and figure out how to get those people back into wellness. We'll be right back after these messages.